Good morning. Welcome to the Mayor's recommended budget presentations for the 2017 budget. John Quincy, Chair of the Budget Committee, and we're going to begin today's meeting on time so we can continue to keep all the other departments moving forward on time. So thank you, Mr. Hecker, for being here, representing Mayor Hodges' office. And I think we can begin if you just take us through your department budget requests.
Mr. Chair, council members, thank you for the opportunity. As you mentioned, my name is Ben Hecker. I'm the Mayor's Deputy Chief of Staff, and it is my privilege to kick off the budget hearings for this year. Our budget should be brief. You can find details about it on page F138 through F142 in your budget books if you're reading along at home. This first slide here gives you an indication of the business lines our budget is arranged around: policy development, policy and program promotion, and policy and program implementation. Much like the City Council, the Mayor's Office is responsible for leading and supporting policy from the beginning stages all the way through the oversight level. We do pre-development work, we do promotion of new policies and existing city policies, and we provide support for departments in implementing and overseeing those policies once they're put in place. We also do a good amount of work leveraging partnerships both within the city, at the state, at the regional level, all the way up to the federal level as well. To deliver those goals, as you can see here on this slide, this is the way that our department is organized. We have 12 FTEs in addition to the mayor herself. We have 6 policy area focused policy aides. We have 1 administrative staff, 1 staff dedicated to constituent relations. We have a policy director, and we have myself. And our budget this year only requests the current service level inflationary increase. As you can see, we don't have any change items for 2017. The mayor respectfully asks that you adopt her recommendation for our office budget. I'm, of course, happy to stand for questions.
Thank you very much. Can you describe the inflationary increases? Is it all in the salary area, or
That's correct.
Okay?
Yep.
Did any other line items, for example, travel or office materials, those weren't anything? It was just in
flat, correct?
supply.
That's just personnel costs.
Well, thank you for that clarification. Are there any other questions from council members on the mayor's budget presentation? Should not be much, because obviously they're not asking for anything. So thank you very much, Mr. Hecker, for your presentation.
Thank you.
Very
Mr.
helpful.
Chair.
And you so far have the record of being 4 minutes. So you have the shortest department presentation.
Happy to be.
I'm sure that will be eclipsed by Mr. Carl in a matter of moments.
Much appreciated.
Well, we'll try.
We'll allow for a few minutes for the transition between the mayor's office and the city clerk and elections department, and take this opportunity to introduce my colleagues on the dais at this time. We've got Councilmember Gordon, Councilmember Yang, Councilmember Bender, Councilmember Johnson, and Councilmember Warsami. As no quorum is needed to conduct these meetings, we're going to be continuing to flow in and out as the day progresses and as the months progress. So, Mr. Carl, welcome, and you're up.
Thank you, Mr. Chair, and good morning to members of the subcommittee. As noted, my name is Casey Carl. I have the privilege of serving as city clerk. It's my pleasure to present the mayor's 2017 budget proposals, both for the city council and for the office of city clerk, which I refer to collectively as the city's legislative department. And as we get started, I'll note that that legislative department, which is composed of the city council, the office of city clerk, represents approximately less than 1% of the mayor's total proposed budget, nearly $9.9 million for the total, which derives from the city's general fund. The remainder largely comes from internal services that are associated with the operation of our Document Solutions Center, a unit that's part of our Records and Information Management Division. The department is composed or proposed to be funded in a total amount of approximately $11.3 million. That's roughly on par with the approved funding plan for the current fiscal year in 2016. The mayor has graciously proposed some change items to the clerk's budget, which I will address in a moment. I'd like to begin in reverse order by reviewing the proposed budget for City Council. It's found on pages F19 to F23 in the budget book, also online. And following that, I'll review the proposed budget for the Office of City Clerk, which is then found on pages F14 to F18. This slide shows that the core programs associated with the City Council include governance and policy enactment, its legislative responsibilities, executive oversight and evaluation, oversight of the administration and operations and delivery of city services, and community representation. The City Council is composed of 13 members, each of whom represents a ward of approximately 31,000 members based on the 2015 population estimates that were published by the United States Census Bureau. That means that each council member is elected to represent a ward roughly equivalent to the entire population of the city of Brooklyn Center. For these constituents, a council member is an elected policymaker, an advocate, and an ombudsman. Individually and collectively, council members represent the needs, priorities, and interests of their constituents and their wards, both as a voting member of the city's governing body, as well as through service with various organizations, boards, commissions, and other groups at local, regional, state, and national levels. And of course, the most fundamental and perhaps most visible aspect of the City Council is its work as the governing body of the city. In that capacity, the council works in partnership with the mayor to enact, amend, and repeal local laws and public policies aimed at ensuring the health, safety, and welfare of the community. From a budgetary perspective, the City Council represents just under $5 million with a full-time staffing complement of 39 positions. That includes the 13 elected policymakers and their aides. The mayor has recommended no changes in this program between the current fiscal year and 2017, so the fiscal impact for the City Council department is largely flat as proposed. And that completes my review of the mayor's budget for the City Council program. I'm happy to respond to questions about that program or to continue with a review of the Office of City Clerk.
Thank you, Mr. Carl. Looks like we have at least one question from Councilmember Yang.
Mr. Carl, thank you, Mr. Chair. Mr. Carl, just a quick question with regards to this budgetary item. Are the council budgets included in the amount as well?
Mr. Chair, Councilmember Yang, yes, the ward operating budgets are included within the budget allocation proposed within the program I just described. Again, all remaining largely flat from the current fiscal year 2016 going into 2017.
Thank you.
Seeing no further questions, so you feel free to continue. Which one are you starting on, Mr. Carl?
Next, I will turn to a review of the proposed budget for Office of City Clerk. That budget can be found on pages F14 through F18 in your budget book.
Thank you.
This slide shows that the City Clerk's office, the City Clerk primarily serves in three primary capacities, which reflect its business lines. First, as Chief Elections Official, the office enables a democratic representative system of government to be achieved at federal, state, and local levels. We do this by planning and administering all aspects of federal, state, and local elections, and by ensuring that voters have free, fair, and equal access to the ballot box. Second, as the facilitator of legislative operations, this office ensures that government policies, decisions, and the processes that support them are accessible to the public. We do this by preparing, presenting, publishing, and permanently preserving the city charter, its codes, policies, rules, and regulations, all of which set forth the rights and responsibilities of those who live, work, and play in the city of Minneapolis. Third, as the official custodian of the city's records, data, and information assets, this office empowers the people to hold its government accountable. We do this by ensuring proper controls and legal compliance across the enterprise with respect to the creation, use, exchange, storage, and disposition of government data within the requirements of law, and by identifying and permanently preserving records that have enduring legal, administrative, and historical value. These three programs and the outcomes that they achieve reflect the hallmarks of good government, making the Office of City Clerk not only an important component of the city enterprise, but an essential unit that provides critical services that support everyone inside and outside of its walls. This slide provides a high-level analysis of the proposed budget for 2017 by program as compared to the current fiscal year. You'll note there is one change item in the next year's budget proposed by the mayor. It's tied to our Records and Information Management Division. The other programs remain relatively flat between the two fiscal years, with minor increases for routine inflation and anticipated operating expenditures. This slide shows a detail of the mayor's proposed 2017 budget by program. So specifically, it divides the operations of the city clerk into two major groups. First, elections and voter services, and then all of our other programs lumped together as Office of City Clerk. This includes funding for the Records and Information Management Division and the Document Solutions Center, as well as the funds that support our legislative operations and department management. I mentioned that Mayor Hodges had recommended an increase in ongoing spending tied to the Records and Information Management Division, and it is for one full-time records specialist position. The request for this position is tied directly to the results of the 2015 records management audit, and it's intended to provide the resources required to realign our existing program to more closely match an internal service delivery model that can support centralized services across the enterprise. I presented the department's management response to that audit in front of the Committee of the Whole at its March 30th meeting, and mentioned at that time the need for this additional full-time resource. The audit found that Minneapolis lacked an effective enterprise framework to govern its information assets, and that this resulted in an inability to validate compliance with applicable laws and policies. State law mandates that all city governments implement and maintain a records management program, and the city clerk is the municipal officer charged with managing that program and ensuring compliance. Using an evaluatory model developed by ARMA International, the audit scored Minneapolis at 1.65 on a 5-point scale, where a rating of 3 is considered minimal in terms of acceptance for demonstrating a compliant information management system. That score means that the existing enterprise framework in Minneapolis fails to meet minimum standards for legal, regulatory, and operational requirements. The city scored lowest on rating criteria tied to systems that demonstrate integrity, data protection, and legal compliance. The addition of this full-time resource will allow the clerk's office to reorganize its operations to match what other internal service departments use, specifically assigning a subject matter liaison to each department, who then can become a partner with those assigned departments and provide them the necessary expertise, consultation and advice, and hands-on support to achieve compliance that we seek to move the city's rating on the ARMA International criteria to an acceptable threshold. In addition, this resource would allow the clerk's office to assume a stronger and more proactive role in providing such centralized services, such as the intake and fulfillment of data practice requests, review and redaction of non-public data, and destruction of data when authorized by law. Next, I'll present recommended funding from the city's operating capital program, what is referred to as CARS.
Mr. Carl, I'm
Yes.
sorry to interrupt, but I did have a question, and it was before you started actually talking about the record specialist position, which I am very supportive of, having sit on the audit committee. I know it's an important step, and I'm glad we were able to get through 2016 and look forward to a 2017 conclusion. I'm looking back at the finance summary of the Office of City Clerk, and I noticed a shift between general fund and non-general fund. Do you have an explanation for why the non-general fund went down a little bit from last time?
Mr. Chair, the non-general fund that's reflected in the clerk's budget is tied to the operations of the Document Solutions Center, which must raise its money internally based on service to other departments. And so it varies by year based on projections, and the finance department works very closely with us in developing those anticipated projections and then watching carefully throughout the year as we get those revenues in.
Thank you. It was a pretty small amount, but I was just curious if some of those had been shifted to general fund items. So that's fine. And were there any other questions on the other portion? Not seeing any. Please continue. Back to CARS.
Certainly, absolutely. So under the CARS or operating capital recommendations, Mayor Hodges has recommended funding totaling $180,000 plus some dollars for the existing project to acquire and deploy an enterprise-wide legislative information management system, which we refer to as LIMS. The clerk's office has deployed an interim solution, but we also have been contracting for a permanent solution with a company called DataNet. That project is scheduled to bring online the permanent solution in the first quarter of 2017. This additional funding will fill the gap in the initial project account to ensure that we're able to bring all aspects of that application online. That includes not only technical support for the legislative operations of City Council and its standing committees, but also modules to support the independent executive and audit committees, the Charter Commission, other appointed boards and commissions that operate within the enterprise, and also to support our opens appointments process and automated processes for the centralized production of public notices and calendars. So of all these, the data will be made accessible 24/7, 365 through a web-based portal. That concludes my review of the mayor's proposed budget for the city clerk department. I'm happy to stand for any questions.
Thank you, Mr. Carl. I, like all of us, I'm sure, are looking forward to the legislative management system. Congratulations to the staff who has gotten us through this point. I know we've had some fits and starts with providers over the last several years. Certainly a very important aspect. Councilmember Yang has a question.
Thank you, Mr. Chair. Mr. Carl, when I'm looking at elections and voter services, I see a decrease of about $360,000, and just wondering, in this election year and the next that's coming, what's the impact, in that situation?
Mr. Chair, as you know, this is a very interesting subject for us because elections are a volatile issue, not just here in Minneapolis, but in all communities that administer elections. Each election has its own character, if you will, based on the issues that are at play within the community, the campaigns and candidates that are happening. So from a budgetary perspective, looking forward or prospectively, the Finance Department works with us to provide a stable rate of what we can count on for every year's elections that we administer. We also work with them throughout the year for any unanticipated costs that then they work within funding resources to help us to pay for the needs of administering that specific election. And you'll also recall that after every election, we do a debrief with the Elections Committee, which says, among other things, lessons learned, but also the total costs for that election and a justification of why those costs were incurred beyond that which is appropriated within the mayor's budget approved by council.
And Mr. Carl, typically, what's budgeted, let's say in a given year, let's say any random given year, is that usually what is spent by elections and voter services, or in a situation where, let's say in a given year, we have costs that just run over. What happens in those situations? I think you kind of alluded to it, but if you can explain that, that'd be great.
Certainly. Mr. Chair, Councilmember Yang, the elections budget has to be seen as two buckets, or at least this is how I approach it. There's what I call our operating budget, which are the permanent full-time staff and our internal operating resources. That's a set cost that carries year to year. In addition, we have our election cost for that year. So in a 4-year cycle, we have a presidential, we have a gubernatorial, we have a municipal, and we should have, hopefully, knock on wood, an off year. And so in each of those 3 years during the 4-year cycle, we have to work with the finance department to anticipate what the financing needs will be for that specific type of election based on projected voter turnout and participation, how many precincts we have. As you know, we added 7 new precincts this year. That has an unanticipated costs associated with it because that wasn't something that was built into the budget. So again, we have our operating bucket that pays for the day-to-day costs of an elections unit. And then we have the election-specific costs, and we work with finance very closely to track and monitor any deviation from what's appropriated to the elections office each year. And then we do a reconciliation at the end of the year in terms of any overture from that. And I am happy to let Ms. Green speak in more detail if she has things, but I think at a high level, that summarizes how the elections budget is funded and how we manage those expenses.
Yep. Councilmember Yang, does that satisfy what you're looking for? Thank you very much. Any additional questions for Mr. Carl? Not seeing any. Thank you very much.
Thank you.
right,
And good
that
luck
con-
to the budget committee.
Thank you very much. That concludes all of the city clerk elections and
And
city council
Yes.
portion of it. Obviously, you're over the 4 minutes for record by Mr. Hecker, but the city council portion was less than 4
Thank
minutes.
you.
I just wanted you to know.
Thank you. My competitive spirit. Thank you.
Do we have is the health department going to be ready to present theirs, or are we going to wait for the commissioner? We're running a little ahead of schedule, so we'll allow for a little transition time. So we'll take a 5-minute pause if we can on this portion of it. We'll begin with the health department at the conclusion of that. I do want to point out we've, of course, been joined by Councilmember Palmisano, and I just wanted to point out Ms. Green, who's going to be is our budget director, and is going to be in and out and crazy for the next several months. So thanks very much, Latonia, for being here and helping us guide through this. So we'll see you again in 3 minutes.
Let me explain maybe. You have a thick packet, and I will be using a thinner version. Yeah, okay. Yeah. Okay. Good morning.
We are back. We're ready to take up the Health Department budget presentation for the 2017 Mayor's Recommended Budget. Um, Just as a reminder, I'm John Quincy, the Chair of the Budget Committee, joined by Council Members Bender, Yang, and Gordon. And as I mentioned earlier today, we're going to be certainly coming in and out. Other council members have been here and will be back presently. Also sharing information about Latonia Green, who's our Budget Director, and of course Kelly Geester, who remains our City Clerk on this. Ms. Commissioner Musicant, if you're ready to present the Health Department, welcome.
Thank you. Thank you so much. You have received, as an attachment to the your business, your agenda, a thicker packet that includes everything about our department's budget and some slides that show you the results of some of the work that has been funded, both by the general fund and other sources of funding. Due to the time that I've been allotted today, I'm going to focus only on the mayor's recommendations. And so there's a smaller set of slides that, do we have paper copies for them too? There are paper copies if you want to follow along on the smaller one. Okay. So let's proceed. I'm going to go right past the organizational chart. And what I'm going to do in the next few slides is this lays out the various program areas of the department that, as I said, are much more robustly described in the larger pack of slides. But I will at least tell you what the department is up to. We have a family and early childhood, quite a robust program in that area. When we created these slides, the mayor has recommended some additional funding or some funding for East Africans with disabilities. I thought it would go here. It will probably end up going in our public health infrastructure section in the final budget, but I will describe it placed here. We also have program areas of school-based clinics and youth development. There's several mayor's recommendations in the area of youth development. Youth violence prevention is another robust area of our department's work, and you'll see quite a number of mayor's recommendations in that area. Healthy living is almost entirely grant funded. You'll see one small recommendation from the mayor for some general fund one-time expenditures in that area. Lead hazard and control, there is a recommendation for an additional FTE and some one-time funding. In food, lodging, and pools, there's been quite a growth in the restaurant business, hospitality industry, and so the mayor's recommending 2 additional FTEs there. And in environmental services, there have been some changes in the fees that we charge to polluters, and so the mayor's recommending a couple of recommendations there. In the area of seniors, there is no mayor's recommendation, but I just wanted to pause for a second and say that some of you may be aware of the Skyway Senior Center that the city operates really with total sponsorship of another entity. And until recently, UCare was that sponsor. They've had a change in their business and so are no longer able to be the sponsor. We have aggressively explored other sponsorship options and continue to do so. We are also looking at the idea of a soft landing for participants, so some other entity that wanted to provide services to seniors in the downtown area. There's an organization called Friends of the Skyway Senior Center that has been raising funds over time, and we are using those funds to bridge this period of time for us. We expect that we can continue to operate with that kind of support into early 2017, but there may be a need for some one-time bridge funding to help us either find a soft landing or find a new sponsor. Another,
Excuse me, Commissioner. Councilmember Johnson has a question.
Thank you, Mr. Chair. Commissioner, I was just curious, do you know in this budget if we're including our block grant nurse programs, any funding like we did last year? You know, we had both included in the budget for Nokomis Healthy Seniors, but then we also had an amendment that the council approved for Longfellow Healthy Seniors and for, I believe, Seward or Southwest Healthy Seniors.
there's no mayor's recommendation about that.
So that was one-time money and that will not continue, basically, in this budget. Okay, thank you.
Sorry, Mr. Chair.
You're right.
So another area of work in the department is emergency preparedness and infectious disease. And then the final area is the core public health infrastructure, where I did mention we'll probably put that Somalis with Disabilities program. So I'm going to start with a slide on a reduction to our general fund spending, which the mayor included in her budget recommendations, that there be a 1% reduction in every department in their general fund support. For us, that comes up to $65,000. We have recently received news that we have a new 5-year grant from the Center for Disease Control and Prevention called Preventing Teen Dating and Youth Violence, Addressing Shared Risk and Protective Factors. That grant will support 50% of a project coordinator who is currently general fund supported and 20% of an administrative support person who is currently general fund supported. So that we can, with confidence, say that for the next 5 years, we can make this cut of $65,000 in the general fund. This does, however, put us in a tighter financial situation because we are quite grant dependent, and we like to operate in a way that allows us not to have to hire and fire people for short periods of time between grants. Grants received are in large part leveraged by the general fund support that across many parts of our business. And in fact, for 2017, 51% of the department's budget is non-general fund support. Of that, in 2016, a fairly large share of it was competitive grants, $6.3 million in competitive grants so far in 2016, which is a 7% increase from 2015. So let's begin with the mayor's recommendation for new funding for the department, starting with the East Africans with Disabilities. The mayor is recommending $30,000 in one-time funding. Many recent refugees and immigrants have disabilities that lead to civic and community isolation and carry significant impacts on their quality of life. And so some of the identified community needs related to this are in the areas of English proficiency, basic math skills, access to government assistance and employment placement, and access to specialized medical care. So the outcomes of this one-time funding is that we will contract with a community agency focusing on empowerment and leadership by East Africans with disabilities to address isolation and access to services. Now into our program area of youth development. The first recommendation is $100,000 in ongoing funding related to young men's sexual health and associated outreach. Chlamydia infection rate amongst teens, 15 to 19 in Minneapolis, is more than double the statewide rate, and the rate of gonorrhea infections in Minneapolis is 4 times higher than the statewide rate. Youth of color disproportionately represent the majority of the cases identified. In 2015, we conducted a youth-led community needs assessment partnership with Youth Prize and reported these results to our City Council committee, HECE. The youth interviewed youth of color about healthy sexuality, Major themes that emerged were the need for greater access to free or low-cost condoms, the need for testing and treatment, especially in schools, on the streets, and at community-based sites. So this funding is in line with those recommendations, and the goal is to provide testing to 800 young men and provide 1,500 additional one-on-one and group educational opportunities. You'll see in this slide that the proportion of our youth who are African American or Black is about 20%, but the proportion of those youth, or the proportion of youth who have chlamydia or gonorrhea who are Black or African American is much higher.
Commissioner, a question from Councilmember Johnson.
Yes.
Thank you, Mr. Chair and Commissioner. I certainly think these are important items here. I remember when growing up as a teenager, the school clinics offering free condoms to students, and I remember a number of clinics available around the city that already provided free STD testing. So I'm wondering how has that situation changed? Is this to go above and beyond what's already happening? And can you kind of paint that whole picture for us?
Yeah, Mr. Chair, Councilmember Johnson, yes, our school-based clinics still make available all kinds of contraception, including condoms, and there are community clinics, but young men are often not highly affiliated with healthcare, and I think that maybe we could generalize that for men in general, but certainly young men. And so that has been one of the kind of program areas. We did a federal research grant a number of years ago that found that we really need different strategies to reach young men who are disconnected. And that is where the concentration of some of these infections needs to be addressed.
Gotcha. Thank you.
All right. The next recommendation from the...
Oh, I'm sorry.
Yep,
Councilmember
I'm sorry.
Bender.
Thank you, Mr. Chair. I just wanted to mention, I recall when the young men who were part of the program came to present on this last item, and it was actually a very powerful presentation, one of the most significant I've seen in my time on the council. So it's a small program within the health department that has a specific goal around sexual health and disease prevention, but I thought the reach of the program went much farther, and especially in the way that I saw leadership development opportunity in the young men of color that presented. I just wanted to note that, and I think for folks who aren't on the HESA committee, again, I think it was one of the most impactful presentations that the committee had ever seen, and one of the most impactful things the council had, just the voices of the youth sharing their experience.
Mr. Chair, Councilmember Bender, thank you. That's our recollection as well. We think that when we engage young people, help them identify what's going on in their community and listen to their recommendations, that we are quite well served.
Thank you.
The next recommendation is a continuation of something that was funded last year, a 4-H partnership for Somali youth. The recommendation is $50,000 in one-time funding to continue that program, which focuses on STEAM, which is science, technology, engineering, arts, and math component of after-school work. The program that we initiated last year because of the funding from the city didn't get started quite as fast as we wanted because of some contract issues. The expectation is that this year's recommendation will result in 40 youth who are served annually. In 2016, we have served 30 so far, with additional youth on the waiting list. So it is definitely a wanted and desirable program in the community. Another recommendation from the mayor in the youth development area is the establishment of Children's Savings Account program, and the recommendation is one-time funding of $15,000 that would flow through the health department to the youth coordinating board to develop such a program. So this funding is for the development, not for the funding of the savings accounts per se. Children's savings accounts are something that's occurring in other communities. It promotes savings and asset building opportunities for children, especially with those from low and moderate income families. Most of the programs focus on helping children access post-secondary education by building both their savings and educational aspirations. So the YCB is already pursuing additional foundation support and additional organizational engagement to create this program. This $15,000 will help us get started.
Thanks, Commissioner. We have a question from Council President Johnson.
Thank you, Mr. Chair, and I apologize, Ms. Musican, for being late. Can I go back to this young man sexual health outreach? I remember a program that the Health Department was engaged in a few years ago with Fremont Clinic, I think was the provider on the north side. What were the results of that program? Good, bad, indifferent?
Mr. Chair, Councilmember Johnson, yes, that was a program that was initially funded by a 5-year federal research grant. And we did show that while other parts of the state had growing rates of chlamydia, we were able to flatten our rates during that same period of time. And so, and reach many young people. They did kind of secret shoppers in the clinics to see how accessible the clinics felt to young men. They did all kinds of awareness raising, doing at the time CDs, rap CDs, and community outreach. We have tried to keep that alive as a program because it was quite valuable reaching young men who were not being reached in other ways, but have had diminished funds to keep it alive, and so it's become a smaller and smaller and smaller program, which really is not having the impact of the original program. This will allow us to build back up on some of the learnings we had from that grant, and also to modify it based on the input that we've had from the young people that did research in the community.
Okay. Just a curiosity then, if there's some way to look at when we were having these flattened rates, how they compare now with these new numbers as far as infections, I'd be interested.
Mr. Chair, Councilmember Johnson, so you're looking for like a graphic that would show us, you know,
Yeah.
what happened to those rates and what's happened
Right.
since?
Right, that'd be helpful.
Thank you.
And then I guess I would ask now, when you were talking about the children's savings account, you're talking about approaching the, I would imagine, financial institutions then for help in actually getting to the point where we would have funding for kids' savings accounts.
Yeah, Mr. Chair, Councilmember Johnson, Anne DeGroot has actually been working quite a bit on this already, so she probably would be the best to answer. But yes, I think there are both foundations that might be interested in the infrastructure of creating a program, but also financial institutions that might be interested in sponsoring it and holding the accounts.
Okay, great, thank you.
Moving on to the recommendations that are in the area of youth violence prevention. The first is $45,000 of ongoing funding to implement something that we have piloted for the last couple of years called the Blueprint Approved Institute. This came out of an experience we had that many of the organizations that are on the ground working with the youth that we want to reach are small. They're led by charismatic, program-oriented folks who really don't have the time or wherewithal to create organizations that can compete for dollars. And so even as we wanted to give grants to them, we found that many of these organizations just couldn't write the kind of proposals that an organization like a city looks for. And so we started this Blueprint Approved Institute where we go through things like logic models and budgeting and evaluating what you're doing and thinking about what you're doing in terms of best practices. And we believe that it's something that is essential for us to continue in order to reach the young people that we want to reach in our community. But it's also a model that might be of interest to the rest of the enterprise in terms of really looking at equity and trying to be in relationship and build the capacity of community-based organizations that we'd like to work with, but also maintaining our own standards. The second recommendation is $40,000 in one-time funding for community outreach and engagement related to youth violence prevention, especially focusing on the 18 to 24-year-old group where schools maybe are not in session or where young people are no longer in school. And so the activities, the types of activities that would be funded would be an annual conference that we have begun to hold. We've had it, I think, twice now, so this would be a third time. Bridges to Manhood Conference, really focusing on young men and incorporating rites of passage into that conference has become quite a powerful experience. Partnerships with local agencies to create activities around Youth Violence Prevention Week. You might want to look at, there's a link in your slide to a short video that was created by someone in the community around activities that occurred last time this year during Youth Violence Prevention Week and the power of changing the narrative. Partnerships with local agencies to provide programming during the summer of 2017, including late night basketball, and then continuation of our pop-up parks, which bring positive activities to areas that are either identified by the police as having maybe gathering people for not the best purposes, or where there are parks without programming in them, brings a different sense of place to communities. The next two slides have to do with group violence intervention, and so I'm going to spend a little more.
Excuse me,
Yes.
Commissioner.
Mhm.
Before you start the next slides, I did note Councilmember Yang had a question.
Thank you, Mr. Chair. Commissioner, with regards to the youth violence prevention, I see all this stuff. It sounds really great, but at least in Ward 5 and Ward 4 as well, I mean, there has been a spate of gang violence happening up there, and I don't see anything related to gang violence, here, anything related to curbing gang violence here, and I'm just wondering, with regards to $40,000, but I mean, I would imagine like we would need more money to curb or stop the gang violence that's happening up on the north side, and I'm just wondering if, with regards to this program right here, whether there is any, I guess, sort of thrust to stop that stuff from happening, because I mean I think a lot of the stuff that is happening, it's not necessarily folks who are, let's say, adults who are engaged in this sort of thing. I mean it's actually pretty young people who are engaged in this, and so I'm wondering, I mean, can you help me out to try to understand this, because certainly I can tell you that, from the discussions related to gang violence, it almost seems like it's exclusively within the police department. But I mean, I see funding that goes to the health department for that youth violence. And, I know that there have been stories, in the Strib in which, let's say, the health department has been quoted as saying, we don't have a strategy for curbing gang violence. And so I'm just wondering, I mean, how can we get to a point where, there's that sort of working together between the health department and the police departments to just stop gang violence in general?
Mr. Chair, Councilmember Yang, the reason I'm smiling is because the next two slides are exactly about that. But our youth violence prevention blueprint really looks at the whole spectrum that we need to be addressing, and so these first two slides are more in the prevention. But let's go on to the next two slides that are specifically about connecting the health department's work to the police and are focused on gangs and cliques.
Before you do that,
Yes.
I just want to check in with the Council President. Did you need something before we go to those next two slides, Council President?
I would just agree with my colleague, Councilmember Yang. We have huge challenges in our community with violence, and as I look at 100,000 here and 50,000 here and 40,000 here for a new program, what we're doing is not working. And so everybody's been patting themselves on the back saying we've made great strides in youth violence prevention, and I have to disagree. So I think one of the things we have to do is look at what we're doing. This is new stuff. What are we doing along the lines of what's already embedded in the budget? This is additional, and I think it's time for us to have a presentation about exactly what we are doing, what works, and decide then where we put our dollars. Because again, I see all new programs, a whole bunch of new programs, and I know things are already embedded in the budget. And that to me is we need some kind of look at outcomes for what we're doing. This sexual health is just another one of those things. We're doing this. We've diminished the funding, as you said, for that. So now we're going to up another $100,000. Well, I want to know, when we did this check yourself or whatever it was called, did it work? And that's what it was called. I think I'm right, yeah. Did it work? It didn't work if we're up to 4 times the rate of the rest of the state. I mean, we're taking 10,000 here and 50,000 here and 40,000 here without any realistic look at if we're making progress. I find it very frustrating. The other thing I want to say is that it is a challenge for, I guess I would say, I probably have 2 or 3 calls a month of people saying, I have a nonprofit and I want to work with youth. I have people calling me, telling me they want us to buy a house or to give us one of the vacant houses so that they can, work with youth. There are lots of good, well-intentioned people out there, but I want us to be really careful when we do this kind of choosing about who actually gets dollars or is capable of applying for a grant and managing a grant, that we are careful about who we do fund. Because as I say, there are hundreds of people that call in a course of a year. I've got a youth program. I love kids. I can't stand watching what's going on, in my neighborhoods. But, we need assurances if we're going to fund them, that the protocols need to be in place for people working with young people, background checks, all that stuff, financial accounting. I don't want to be embarrassed again. And I want us to be really careful about that. Thank you.
Mr. Chair, Councilmember Johnson, I hear your comments. The Blueprint Approved Institute is actually focused on building that capacity. It's mostly education of these agencies, and then they're on their own, and hopefully they can compete. But we thought that we needed to help try and bridge that distance and still, so that we could hold them accountable if they are funded with us. As it was, they were never getting a chance to even have grants with us because they didn't have the capacity. Now, they may or may not be able to compete for grants in the future, but they'll be further educated. 2 of the 7 that we worked with the first year were able to go and compete for some other grants, non-city grants. And so it builds community capacity that way as well. Some of this, the first 2 slides that I reviewed with you are programs that were funded by the funding we got from the federal government through the National Forum on Youth Violence Prevention, which is an Obama administration initiative. And so we don't expect that is likely to continue. And so that's why we're looking for one-time funding to keep it going in 17 and see what the new federal administration directions are.
Commissioner, Councilmember Andrew Johnson. I always get the Johnsons confused, so
Thank you, Mr. Chair. Commissioner, I also share the sentiments of my colleagues on this as well. I think that every council member wants to tackle youth violence and wants to find the best way to do it. And I think it's just a question of, are these the most effective strategies or not? I just look at page 26 on the longer presentation we have here, and it looks like we're at a 5-year high of youth violence. And we have increasing upticks in that. And I understand it's a complex issue. There's many factors involved here, from economic security of parents and their ability to ultimately be home and present and help with the kids, to education, to disparities in the community. And there are a lot of different factors on it. But I think that what I get concerned about is, and not to beat up on group violence intervention here, but I'll just point out where the concern comes in. This very well could be effective, but just reading here about how one of the activities of this is to communicate the consequences for continued engagement in future violence. And I know it's said that criminals are dumb, but I can't believe they're that stupid that they don't understand, hey, there's consequences for future violence. And so I just want to make sure we're putting our money into something really comprehensive here that's getting at the core issue, and that we're using data and follow-up and continuous process improvement to make sure we're actually getting results and able to measure those and specifically tie those to the investments that are happening. So I don't mean to make you feel beat up on this. That's not the intent here. I just wanted to express that I think there's some concerns you've heard about these investments. And I hope we can follow up offline and talk more about this, and so I can better understand the request here and see to it that ultimately we're getting our taxpayers' money's worth.
Thank you. Mr. Chair, there will be a presentation on our youth violence prevention work at the HECE committee Monday, I think. So coming right up.
Before you launch,
Okay.
just wanted to point out, I don't know if yours was most of a comment, or did you need a response? Okay, thank you. And Councilmember Gordon.
So I just wanted to respond a little bit about some of these items, because I've tracked this very carefully as chair of the Health Committee, and also as serving on the Youth Violence Prevention Executive Committee. And I really appreciate what the council president said about some of the nonprofit organizations that were operating out there, and I think that's one of the reasons why we decided to hold back on funding a lot of organizations until we could bring them, see which ones could actually have the capacity to handle some of these issues, and some just don't, and they're good intentions and they're working hard, but just to get to that certain level where they can handle it is a challenge. And so some of these little bits of money is just to help build that capacity and see if we can't help grow some organizations to take some leadership. And we'll see. The group violence intervention model is actually something that we arrived at because of the uptick and because we're really coming back on a crisis. Tracking this for many years, we saw for several years decline in youth violence and homicides and gun injuries, I think up until 13. I think there was one year there, was it 2013, where we had no juvenile homicide technically. But now we're seeing a dramatic, I think it's a dramatic and significant uptick, and especially in certain parts of the city. And so that's why this focused group intervention model is something that we're turning to. We've talked about things like this. Project Ceasefire kind of used this concept, but this is actually something that the National Network for Safe Communities from John Jay College is leading on, and other groups. So it's a best practices model, and there's federal funding to help us do it. And really what it is you identify the most likely perpetrators and victims of the gun violence. So we're going right to the most at-risk individuals to try to intervene, both with both with an understanding of what kind of consequences you could have. And actually, it's the graphic understanding of those consequences that gets some people to change, because they really aren't that aware of them. I just heard yesterday a story about an emergency room doctor who basically said, I've seen you 3 times now. The next time I see you, you're going to be dead if this keeps up. And that seemed to motivate somebody to actually change and suddenly say, I need some help, and got on the phone. So sometimes people are a little bit oblivious to that, as well as partly what this group intervention model does too, is say, we're calling you all together in a room, and we're the police and we're the government and we're social services, because we know what you've been up to, and there's consequences legally if this continues, but we also want to try to get you out of that. So that's part of the model. And I just want people to know it is focused on the statistics and the crisis that we're in now, and the group violence intervention model is aimed at trying to get those people and say, either you get help or we're going to help you get off the street or whatever and change your way. And I didn't mean to take your 2 slides up.
Oh, thank you very much, Mr. Chair. So thank you. This has been a wonderful warm-up to the next 2 slides, the group intervention recommendations. So the mayor is recommending $140,000 in ongoing funding for operating costs for the group violence intervention program. And as Councilmember Gordon mentioned, this is a collaboration between the department, the health department, the police department, and community members. And it's essential to have those 3 component parts for it to work. It is a best practice that has been recognized by a number of the organizations that we are affiliated with. It aligns with all kinds of national organizations, as well as our blueprint. And so this ongoing funding will allow us to fund 2 sites, one in North Minneapolis, one in South Minneapolis, and provide the essential program coordination and provision of community-based supports for the engaged participants. I won't spend time talking about how it works, because I think you've heard that from Councilmember Gordon. But if you have additional questions on how the program itself works, I would be happy to answer those questions. The second mayor's recommendation related to the group violence intervention is for some one-time funding to jumpstart this program to really help us develop the communication plan, because as I said, one of the three very important component parts of this is the community. And so we want to work with the community to talk about what this program is and identify the community support for it. And also to identify those resources within the community that would help people if they do choose a different path and they want some help with doing that. Recently, we have heard that the city has also received an OJJDP two-year grant related to group violence intervention. And so this mayor's recommended funding will help us leverage and jumpstart those efforts in combination with that new grant.
I'm sorry, Commissioner.
Mhm.
Just checking who's that. I see Councilmember Yang.
Thank you, Mr. Chair, and Commissioner Musicant. For myself, when I look at these issues related to group violence intervention or youth violence prevention, every single year, we have an issue related to, what's called the summer strategy for the North Side to curb violence on the North Side. And, I was surprised this year that, there was a story after a shooting up on the North Side sometime in May where, one of the folks from public health said something to the effect of like, we have no strategy right now. And, I'm just thinking like, if the health department is putting itself in, I guess, in the situation where, you're looking at violence as a public health crisis as well. I'm wondering, it would be nice to see the public health department be a part of the, I guess, strategizing or getting to the point of having a summer strategy as well on the North Side, just because, we can throw all this money at, every single great program that's out there. And, for some reason, we still have the violence that is happening up there. And so, as Council President Johnson said, we have to do things differently. And wondering, if that has to look different or has to be different to get to that point, because certainly it's still happening.
Mr. Chair, Councilmember Yang, thank you for your comments. I'd have to be reminded about that quote, but I do feel that we are heavily engaged with others in thinking about summers and the community. There is an issue of resources, and we have tried through the years of the blueprint, and I think we have, as a city, demonstrated great persistence in using this model of prevention of youth violence, while at the same time we have an intervention model from the police, and they're complementary. We have, just yesterday, the Youth Violence Prevention Executive Committee had a conversation about responding in the crisis mode to when a young person is injured in the community, and I think that's one component part we haven't fully fleshed out as a city, and so perhaps that comment was related to that. But yes, we are definitely interested in feedback and assessments of how we're doing. We are also putting together Results Minneapolis around youth violence prevention coming up this fall that I hope you will be a part of and think with us about what's going on, what are we trying, what's working, what's not working. So I'm going to move on, if there are no more questions on that, to a recommendation of some one-time funding from the mayor for $150,000 for a group violence intervention program. This is something we already have that's funded to some extent by a general fund, and so this would be a bump to recognize the growing demand for this service. And so it's something that is organized around helping young people who are at risk for creating violence or being victims of violence and long-term case management for them. It has become an integral part, an extension of the police. Let's see. Oh, I'm on the wrong slide. Inspiring Youth. Okay, let me name it right, but that's what I was talking about. It's the Inspiring Youth Program. So that's a $60,000 one-time funding. But what I said was true. This is because of the increased demand for the services for this program. It's become really a critical supplement to the police department's juvenile diversion program, which is a short-term program. And so this allows for those young people that have longer-term needs to have those addressed so that they can stay going on the straight and narrow, if you will. We also know that a new program that the Hennepin County Government Center, or HCMC, the hospital, has created called Next Step, is a hospital-based intervention program. Will probably build a demand for this work, this Inspiring Youth program, as well as the GVI program that we just discussed. So we hope that all these things work collaboratively, and this one-time funding will allow us to provide the services that have been, where there's a pent-up demand, and also respond to these new and emerging demands for the service. We have found that in its first year of implementation, that those who have participated for 9 months is a decrease in trouble with the police and decrease in other risk factors as well. So on to another program area, healthy living. There's a recommendation.
Excuse me, Commissioner,
Yes.
before you launch into
Yes.
the Cedar Riverside, Councilmember Bender.
Thank you, Mr. Chair. Just wanted to note, as you wrapped up that kind of first bucket, that I have the perspective, I think potentially again because of the presentations that we get to have at the HESA committee from your department, that the health department actually does a very good job of setting specific outcomes and measuring progress toward those outcomes. So I'm looking forward to seeing the presentation on Monday about some of this youth violent prevention work. You know, I think we've all watched that violence in our city has increased, and some of these upstream interventions may seem like, you know, plugging holes in a wall, but I think that we can't not do them. I think that they are so important in a time when we're seeing the downstream impacts of cycles of violence and poverty, particularly in our communities of color, and that these are some of the most directed investments that we make upstream in trying to help youth break those cycles of violence and poverty. And so they might, I mean, I think we're relying on your professional recommendations based on the research that your department does, based on your experiences with programs in the past and those measurements of those programs, that these are the things that you think are the most impactful. And if folks have other ideas, that may be the case, but I think there's a strong case to be made that these are very important investments that, you know, compared to spending that we make in other departments, these are very, very small investments that are critically important to sort of avoid continued increase in violence and poverty.
Thank you very much. So in the area of healthy living, the mayor's recommending a $10,000 one-time funding to increase provision and promotion of physical activity opportunities in Cedar Riverside. We're working with the Cedar Riverside community. We've identified quite an appetite and need for exercise options that are senior-friendly, culturally appropriate for East African women and for Korean residents. And so we're working with community-based agencies to expand what their offerings, doing policy system and environmental change. The funding that supports this work will not allow us to do programmatic funding, and so we think this one-time infusion of general fund dollars will help to launch this expansion of community-based efforts and systematize them so that they are available in the long run. Next area is lead and healthy homes. As you may recall, in 2015, we began to intervene. The recommendation from the mayor is $110,000 in one-time funding for 1 FTE of a lead risk assessor. In 2015, we lowered the level of blood lead that we use in order to intervene from 10, it had been 10 to 5 micrograms per deciliter. We thought that this would result in a one-time kind of blip in a larger caseload. It's resulted in a almost 250% increase in our caseload, and it has not abated. And so there was one-time funding in 15 and again in 16. All indications are that this higher level of cases will continue, and so the recommendation is again for 2017.
Commissioner, you mentioned the change between 5 micrograms to 10 micrograms, and you said we did that. Was that something the commission or the health department decided on, or is that state or county policies?
Mr. Chair, the state health department lowered the rate at which you could choose to intervene,
I
and
see.
so we took advantage of that opportunity at the city level.
Very good. Council President Johnson.
Thank you, Mr. Chair. Just a curiosity, Ms. Musican, about lead, and as you say, the caseload is going up. When lead has been removed from paint for many, many years and out of gasoline and all that sort of thing, to what do you attribute that? I mean, just the holdover of homes that haven't been treated, or?
Mr. Chair, Councilmember Johnson, yes, any home that was built before 1970 probably has paint on it that's underneath some other paint, perhaps, that has lead in it. And so it's particularly a problem in windows, because windows, we move up and down, and we create dust. And so the dust that's created from that old paint that's hidden under a few layers of something else then is on stuff. And we know that very young children who are highly susceptible to the intoxicating or the toxic effects of lead also are mouthers. You know, they explore their environment by putting things in their mouths. And so it isn't children eating chips of paint or anything else, but it's the dust. And so if we can go in and we can actually give a home a new window that has no old paint on it, that's all new, we can really create a different rental environment so that additional families that might show up in that same rental unit are not going to have risks for their children.
Do we have outcomes again that, I mean, we've been involved in lead remediation for a really long time through federal grants and our own dollars. Do we have statistics to show? I mean, I get where if you reduce the level of where you treat, you're going to increase your caseload. But I mean, do we have statistics to show that we've treated this many households and homes and that's helping? Or I mean, are we just creating more of a problem by? I know it's, but what's a good lead level is 0. But anyway, I'm just curious about how you evaluate if you're changing your dynamics of what's a problem. Then how do you evaluate that you're making progress then on the city's existing housing stock, which is a finite number? How many houses have we treated? Has that been helpful? Do you measure lead levels in homes where they have been treated? Have we had repeats where kids were, you know, in their 1 year treated and then moved on, and someone else came out of that home with a lead level problem?
Mr. Chair, Councilmember Johnson, yes, we have begun to do some mapping of the city to see where, you know, which communities we have changed the housing stock in, and we are also exploring strategies like going door to door to do more inspections that are not reliant on children being poisoned first, because that's the program as it stands now, which is why it's so important to have lowered the lead level, because we were relying on poisoned children, and at least they're a little less poisoned now when we intervene. But we know that lead poisoning impacts violence. You know, so it changes the brain, and so it increases the likelihood of violence. It decreases school success, and so it's really important we continue to work on this. But you're right, we need to use as many different strategies as possible, because we do have a really high proportion of our housing stock is built before 1970, and so it's a daunting task to fix it all. So we are also working on ideas around like health promotion messages around nutrition, because we know that if a young child's diet is high in calcium and iron, that their body is less likely to absorb the lead. And so we want to fix the housing, but we also want to help families protect their children to the best extent that they can if they are.
I'd be interested in seeing that mapping, because I'm just curious whether, if we've treated a lot of apartment buildings, or if we've treated in North Minneapolis, at least the rental housing stock is almost exclusively single-family homes. It'd be interesting to me to see where the dollars have gone. So, thank you.
Mhm.
Commissioner, it's been a robust conversation, and I certainly don't want to reduce that, but I just want to point out the time. So I just wanted to alert you to that, and before that, I'll violate my own comment and go back to the lead conversation, because certainly any lead poisoning is too much lead poisoning. But this additional funding, one-time funding, is for an assessor of somebody to go out and do some kinds of inspections or field work to do that. It doesn't remediate anything. But some of the work that we've already got going on allows that identified opportunity to go in and be remediated. I just didn't want to say, we're just going to go out and evaluate which needs lead remediation, but we have programs in place to remediate those.
Yes, Mr. Chair, we have HUD funding that helps us actually come in and remediate the homes, but we need people to go make that assessment.
Thank you. I won't interrupt you again.
Okay, so we have, I think, just 3 left, so hopefully I can be, although they are significant. So the first one is in food, lodging, and pools. We need more health inspectors because of the growth in the industry. The recommendation is $165,000 of ongoing funding for 1 new health inspector and 1 clerical support position who would manage the data entry and keep pace, and all of this would help us keep pace with industry growth. We have a thriving food and lodging industry here in Minneapolis, and there's been an increase of $1.3 million in city tax revenue and fee revenue in 2015 over the previous year. So we have, financial growth as a result of this. We need to spend some of it on making sure that things are healthy. The number of health inspection establishments in 2015 increased by 625 over the previous year. The number of licenses inspected by health increased 21% over 2 years. And we have seen continued growth. The U.S. Bank Stadium itself just brought 140 new establishments within the stadium. And we know that the State Health Department is going to create a new food code, which will create more flexibility for businesses, but will also create a greater burden for inspectors, increasing our workload. We have 2 delegated agreements that we work under. One is from the State Health Department. We've received good and high marks from them. We also have a delegated agreement with the Agriculture Department, and we've done an internal audit and showed that we really are not meeting their expectations for inspection frequency. So our staffing levels are far behind national standards and our regional partners. We have 1 inspector for every 300 establishments, which is 33% higher than the FDA recommendation. It would take 7 additional inspectors to get to the FDA level. We've worked really hard to be an efficient organization, working on education and outreach and trying to make the folks that run our food businesses, really up to speed on what they need to do. Despite these efficiencies, it really would take us 3 additional inspectors to really maintain the inspection frequency that we need, given the kind of growth we have. As you see, the recommendation is for 1 inspector and 1 clerical support position. You can see on the next slide a graphic that shows a widening gap between a number of inspectors and the FDA recommended number of inspectors, and also quite a large gap between the license revenue and the staffing levels and the trajectory of the 2 graphs. Final 2 areas of
Gretchen?
Yes.
Councilmember Johnson had a question.
Thank you, Mr. Chair. Commissioner, just want to say how thankful I am for all the great work being done by health inspections. I think it's one of those things that it's easy for people to forget about when they have such confidence going out to eat and they just assume, oh, it's just always been that way. But I know that our inspectors do tremendous work at catching problems before they arise to the level of people getting sick and ultimately ending up in the hospital or even worse. And so I just wanted to say I'm supportive of, and I hope I can find some other colleagues that are supportive of getting you the needed inspectors in order to meet those minimum standards. And it is really a core service and something that I believe our constituents expect out of us, and something that we need to step up to as we continue to grow our industry. And we're very thankful for our great restaurant industry, but part of that as well is making sure that all those restaurants are safe for everyone. So I just wanted to make those comments and say thank you to the whole team for all the hard work they do.
Mr. Chair, thank you. Mr. Johnson, I will convey that on your behalf. So the final two recommendations are in the area of environmental services. The first one is $17,000 for one-time funding to really put into our new electronic land management system all this paper records we have of existing wells and underground storage tanks. Without doing that, we won't be able to really see where we have opportunities to abate some of those situations when there is a change of ownership or some redevelopment of a property. And so this is a one-time investment. The switch over to the ELM system is kind of a unique opportunity, and so I think it makes sense to invest in that at this point in time. The second and final area is a recommendation of pollution reduction initiatives, and this is $255,000 for one-time funding for pollution reduction efforts for businesses that pay the PCAR, which is the Pollution Control Annual Registration Fee. There were some revisions of this made in 2016 by the City Council, and those revisions will result in an estimated $340,000 additional dollars in 2017, and so clearly this recommendation will be covered by that increase. So these PCAR fees are pollution impact fees paid to the city by a polluting business and industry. And they support both the inspection services, but they also support environmental initiatives that are directed at reducing pollution and the impact on residents. So we don't want to just fine people, but we want to use and invest some of that resource into reducing the pollution. And so these changes that were made in 2016 will increase the fees paid by the garbage burner, XL, NRG, heat fuel consumption, and there are some additional fees for fuel tanks and wells. And so we want to add to our green business cost share model an approach that will also reduce energy use. And we expect that we would be able to, with this program, eliminate an estimated 4,000 metric tons of carbon dioxide emissions per year as a result of helping businesses convert their practices. And so you'll see in this last graph, the existing green business program has really an amazing acceleration of impact. And in 2016, we expect that by working with businesses, helping them change their practices, we have reduced annually 33,000 pounds of volatile organic compounds being released into our neighborhoods. These are not smokestacks. These are not remote polluters. These are in our neighborhoods. You'll also see in the graph that's next to it that the blue line tracks the revenue increase, and with this mayor's recommendation, the dotted line will mirror that trajectory, but still leave the city other resources to do other things. And at the bottom, our projected savings in energy efficiency are equal to reducing vehicles on the street, or gallons of gasoline used, or trees planted. So that completes my presentation of the mayor's recommendations.
Thank you very much. Just opportunity for colleagues for final questions for Commissioner Musicant. Councilmember Johnson.
Thank you, Mr. Chair. Thank you, Commissioner. I just had a question because I didn't see any details on it in the budget book, but I noticed that there was an operating cost increase of $454,000 over last year, and I was just curious if there or what that's about.
Ms. Musicant,
Mr. Chair, Councilmember Johnson.
I'm going to look down to Ms. Green. Is there something that you can identify for Councilmember Johnson?
Councilmember Johnson, the increases in the budget is all the change items that the commissioner has mentioned.
specifically the one-time
It's
change
the one,
items
it's the one time as well as the ongoing cost.
that are added into operating costs and rather than contractual services or salaries and wages for the FTE increases?
Meaning, if you're only talking about, when you said, I apologize, I thought you were talking about the total budget, but you're just talking about a line item, and if you're just talking about a line item, I'll have to go and look at that and be able to give you a reply to that question.
Okay, yeah, maybe we could connect
Okay.
up during this.
Good
Thank you
question.
very much for the presentation.
Thanks very much for that. Councilmember Gordon.
Well, I just sort of wanted to put this out there from the blue. I think the school-based clinics is one of the great programs that we have going. And I know that we talk about how they're in all the high schools, but they're in the major high schools, I guess. There's been some interest in seeing if we can't expand that, for example, into the Wellstone International High School. So I might be curious at some future later date to hear about what that might cost and what kind of challenges that might pose for us. You don't have to answer that right now.
Thank you.
Good. Thank you very much, Commissioner. I think our next presentation is from the City Attorney's Office. We'll let Ms. Siegel a little transition time as we get our new slide set up.
I'm not quite sure which one. Oh, you've got it on your desk. Okay. I thought they preloaded it. Sure, sure. That'd be great. Thanks. There we go. Good morning, Mr. Chair. The City Attorney's Office. One thing to remember about our office is that our budget is split into, has two different, very different sources. Our civil division is supported by the self-insurance fund, and we're in an internal service division, and the criminal division is supported by the general fund. So all of the items, the change items we're talking about, all relate to our criminal division, and they are general fund items. And we're not contemplating any significant changes in our civil division function over the next year in terms of we're going to repurpose some position, fill some vacancies, but otherwise no significant changes that we've requested or asked for. So our criminal division, we have split into two programs. The first is our community attorney program. The community attorney program involves prosecutors who are housed in each of our 5 police precincts. They work with the precincts and with the community and neighborhood safety groups, local business associations on building strategies and addressing the priority public safety concerns and crime concerns in the different areas of the city. The first change item there going into our community attorney program is restoring some reductions. First is to restore a $200,000 reduction made in our 2016 budget. If that was continued this year, we would have to reduce staffing. Second is over time, part of our community, 2 of our community attorneys at least have been funded through the federal formula grant under the Burn Justice Assistance Grant Program. As we know, with all federal grant programs, this has been reduced substantially in size over the last 10 years. It's been reduced by over half. And so with this additional $110,000 in ongoing funding, we'll be able to maintain our community attorney program at its current complement going forward into the future. As measures, we have a whole bunch of measures in our criminal division. I just included a few in our PowerPoint here. But one thing that we've done and has really been innovative around the country, and we have other jurisdictions calling us to ask about it and get information, is the way we deal with chronic lower level offenders. We have the citywide 200 program that we were seeing reduced impact on reductions in recidivism in 2013 with a combination of city funds and the county contributing the balance of a probation officer salary. We've gotten the reductions in recidivism back up with active probation supervision, freeing up all areas of the system from having to deal, with the revolving door of in and out, in and out. In the downtown area, in the first precinct, we've had this focus on young adult chronic offenders, often homeless. In the 18 to 24-year-old range, we work with local, with partners of youth serving agencies, the Link, Youth Link, and others. And there we've seen an ongoing significant reduction in recidivism. And not only that, but kids who are connected with services that they need. There's a couple who have become downtown DID ambassadors, youth ambassadors, and are attending MCTC, for example. So huge success story there and really positive long-term impacts. And then the slide I'm perhaps most proud of that I think Jessica Casper is here in our office helped me as I want to visually show that we have achieved our goal of long-term reductions in recidivism through our Downtown 100 and Focus 1824 program. And these lines show that these people are only in our Downtown 100 program for 1 year, but we see ongoing reductions in new offenses committed by this group. And so I am extremely proud of the excellent work of my office and appreciate the assistance of Jessica in figuring out how to show this graphically. With lots of dollars in savings to all parts of the system as a result, as well as healthier, safer outcomes for these individuals. Something else that we've worked on collaboratively with the courts and with the county and social service providers is the Homes Court, which is a problem-solving court for defendants experiencing homelessness. And here's just some data that the court pulled from 2014 on the kind of results achieved there. Our other program in the criminal division is, of course, criminal prosecution. And there it continues to be a really high volume part of our office, although the number of overall offenses that we handle has gone down over the years. And it's about, I think, 18,500, something like that over the last year. Change items there is we have had $45,000 in ongoing funding in our budget to support restorative justice and diversion programs. We asked the mayor to increase that funding on an ongoing basis. The mayor recommended and the city council eagerly approved additional one-time funding in our 2016 budget. This will bring us up to $100,000 in ongoing funds for restorative justice and diversion programs. And this serves both juveniles as part of the Minneapolis Police Department's pre-charge diversion program, as well as the adults who we deal with in our office.
Ms. Siegel, thank you for that. Councilmember Gordon, I'm not sure if that was left
Oh,
over.
sorry, it's
My
left over.
mistake. Please continue.
And then with our diversion programs, the council funded a diversion coordinator position in our office who has been in place for almost a full year now, and we're already seeing results from that position with significant increases in diversion referrals, 210% in the first year, and we're on track for an additional 30% increase this year. We're still working on trying to get those numbers up even further. We've added new programs this year. We added the Interact program, which is for misdemeanor, non-force involved obstruction of legal process cases. We've had 43 referrals to this program year to date this year alone. And for our driving after suspension or revocation diversion program, we've had 3,800 referrals over 2 years, 2013 to 2015. And we continue to add to our offerings there. And as I've spoken about before to the council, beginning in 2017, with this diversion coordinator and the charging team that the council has previously funded, we'll be able to move to pre-charge diversion. That is when Hennepin Justice Integration Project technology project will be completed, so we'll be able to move to pre-charge diversion beginning at the end of this year, which we're very excited about. Something else that I want to put a little bit of focus on is the legislature this last year altered the law with regard to drug cases. Fifth-degree drug possession was reduced from a felony to a gross misdemeanor. And in Ramsey and Hennepin counties, they put the jurisdiction for those cases with the city attorneys in those two counties. The rest of the state, the county attorney's offices will continue to be responsible. We are obligated by law to offer diversion in these cases. These are, really small amounts of controlled substances, and I mean, we would want to do that regardless. But it is an unfunded mandate, if you will, something we voluntarily are entering into. We want to be able, we want a diversion provider, and we're in the process of finalizing a contract with the diversion provider to be able to offer assessment and treatment options that will cost money. We will keep an eye on this, see how many cases we've got, but we may be back mid-year for supplemental funding, depending on how things shape out and what our needs are in that area. Another change item, one-time change item, is to deal with street-level prostitution, particularly on Lake Street in South Minneapolis. And we're going to begin offering pre-charge diversion services and expand the street outreach that the 3rd Precinct of the Minneapolis Police Department has been participating in, actually initiated, to make sure we've got culturally specific street outreach people out there helping, as well as to be able to offer this option of pre-charge diversion. This is a pilot, and we will see how it goes. We offer, and there is a studied, researched, effective program in Hennepin County District Court for prostituted women, the GIFT program that we are energetic supporters of, and we offer that to all defendants regardless of the number of prior convictions. And for individuals who successfully complete that program, we assist them in expunging any prostitution convictions. Another change item, one-time item, is to implement community-based consequence for carrying a pistol without a permit. The defendants in this area tend to be largely young males, 18 to 24, 25 years old, and significant percentage, and often it's their first adult level offense, and a significant percentage go on to commit more serious violent offenses after. So we want something more effective than time in the workhouse. We're about to issue a request for proposal, and this funding will help fund this alternate community-based consequence, and as well as an additional $20,000 to research and implement some additional gun violence reduction strategies that the mayor's included in our budget, recommended budget. A carryover item, again, this is one-time funding for our 2017 budget, but we've gotten funding for this pilot the last couple of years, is for our violent crime hotspots, domestic violence pilot. And no, I don't think Michelle Jacobson is here. She's the head of my domestic violence team, and is just a really talented innovator in the area, in the field, and highly respected in the field of domestic violence. And we're learning some really helpful and useful information from this pilot. And we we've gotten some numbers back that Michelle has pulled that shows we're making a real difference for those families where a follow-up visit was successfully made with a police officer and a family therapist. We've seen a significant decline in repeat 911 calls. So 13 to 14% in repeat 911 calls for addresses where we had a successful visit, and 27% for those that we did not. And so anything we can do in these violent crime hotspots where there's also this high incidence of calls for service related to domestic violence will help. We are working closely with the county on expanding this to include what we're calling a family navigator, who is somebody, a county social worker, to partner with 4th Precinct police officers so that police officers can give real-time information when they're responding to calls that aren't necessarily criminal calls. People want, the family wants a child who's out of control removed from the house. They want help removing somebody from the house. And we found with these follow-up visits that people don't know where to go for services, and this proactive approach of having a face with the name of somebody who they know they can call rather than a virtual front door, we think is a really promising model to study, and the county has been very receptive, and we're hopeful that they will find some funds, whether through budgeting or through a grant program, to try out that model. Now, instead of just asking for money, I did want to talk about how we've achieved some efficiencies. And in recent years, we have either eliminated and or repurposed at least 4 positions. And for example, one thing we're in the process of doing now is we've had a receptionist who has done a variety of tasks in our office, as well as greeting people who come and making sure they get to the right person. We're using a combination of 311 to answer almost all of the calls coming into our office, so that there's a whole list of questions they are able to answer without needing to take up attorney time or receptionist time, and to direct the calls to the right people. So we're repurposing this receptionist position into a paralegal position in our criminal division to help us deal with body-worn cameras. So I just want to point out we are trying to be efficient, and that actually we have been able to do this repurposing or elimination in at least 2 or 3 of these positions because of our technology improvements in our case management system, where we just don't need as many clerical related positions in our office, and also making benefit of 311 and making the most use of that that we can. Body cameras, we're going to have to see how that goes and figure out what resources we need. I was just at a CJCC meeting this morning where the county was discussing it and additional staffing needs, et cetera. I think the first case we charged after the rollout of body cams involved an assault on a police force during bar close, and we had at least 9 different officers who had videotaped the incident. So to the extent that prosecutors need to review those to prepare for the many thousands of cases we handle, that's a very time-consuming task. So we're just going to have to see how that goes. But we are going to be adding some paralegal help to assist us with that. Sample of measures. Here is.
I'm sorry, Ms. Siegel, before we get into that
Yes.
exciting slide on conviction rate on domestic violence, Councilmember Palmisano had a question.
Thank you, Mr. Chair. Ms. Siegel, behind this one, the other slides on domestic violence and the new family navigator role in the pilot, is that to assist specifically with the incident that the officers were called out for? Because I know often in domestic violence calls, police see any number of things on that call, and there are other issues at hand, like no food in the house, for example. And is that something that we do today with the follow-ups in these hotspot areas, or is that something for the family navigator role in the future?
What, Mr. Chair and Councilmember Palmisano, that's an excellent question because this is going to lead into something else I'm going to bring to your attention. This hotspots pilot is focused on 911 calls coded as domestic violence, but where no police report has been filed. So there's not a criminal case. The people do not want a criminal case. We initially, one thing we wanted to figure out was, is this appropriate that there's no police report? Are things being ignored that really should be brought, forward as a potential criminal case? We've concluded no, but police are being called to help. And so it's in these cases that are not criminal cases, but where the families need assistance, that this hotspots pilot is focused on. And the thought is to connect proactively somebody with knowledge of county social services, a person following up with these families in real time when possible, or at least making a phone call or a house visit after, to see what's needed. Because these are families that need something because they're repeated calls to 911. And so that's really focused on that area. Now, in domestic violence cases, we have advocates paired with the investigators down in the family violence unit of the Minneapolis Police Department. They make calls to the victims shortly after an assault, the 911 call after we become aware of the case. We also provide 24-hour hotline services, so the responding police officers immediately can put the victims in touch with domestic violence advocacy services. Now, we do have a challenge moving forward into 2017, however, because we just found out yesterday, as a matter of fact, that we did not receive another federal Violence Against Women Act grant. And one thing that the grant the most recent grant we received funded was these advocacy positions in the family violence unit. So we'll have to work with the police department and perhaps figure out a way, because we do think it's really important to provide those advocacy services, and that's going to be a challenge. With this VAWA grant, we've made real significant progress on what are called gone on arrival cases, where the alleged batterer offender is not present when the police respond. That can be a very dangerous time, with increasing the rates of cases being charged and reducing the time from offense to case resolution. We believe that the police department will be able to find resources to continue the additional investigation help at the Domestic Abuse Service Center to help us keep progress, sustain the progress we've made in that area. But it's, it's the problem with grants, is it's 2 steps forward and then scramble. And I will say we've been incredibly successful obtaining federal Violence Against Women Act grants. We've got numerous. I think there's only once or twice in my 8 years as city attorney that we have not been awarded that. There are many jurisdictions who beg, plead, and don't receive them, I think, because we do great work. We've got great partners. I've got amazing people, in Michelle Jacobson, our domestic violence team manager, and all of our staff in the criminal division, and great partners in the Minneapolis Police Department.
Thank you. Your results show it for sure.
And then just quickly, a couple of other measures. This trials to verdict, we've increased the number of trials over time, and through a lot of conscious work and effort, improved our conviction rate. And it's healthy for the system, for us, to have to put our foot to the floor and try some cases. It's good for everybody in the criminal justice system. Driving under the influence cases continue to be important to us. We monitor the level of enforcement that has gone down a bit in 2015. We'll keep an eye on that. We maintain a really high conviction rate in this area, even though with all the private defense lawyers who spend a lot of time thinking up new theories for trying to get around these cases, we've been very effective and one step ahead of their latest tactics. Civil division, which always tends to get ignored in these kinds of presentations, is divided into civil litigation and our client services team. They continue to do amazing work day in and day out. And in civil litigation, we have a 93% win rate in cases resolved in court. Something, it's pretty darn good, I would say. And then approximately 50% of the cases we resolve in court, and approximately 50% we settle. It's an important number for us to track, just to make sure we're not just giving away money and being too easy on settlements, and that we can maintain reasonable resolutions on behalf of the city in these cases. Any questions?
Well, in the civil litigation area, what's the budget impact? It doesn't look like there's anything.
What's the what impact?
Any new requests or anything?
No. Civil division, we're just,
And that's
whatever
in-
the formula
Yeah.
for the self-insurance fund, we have not asked for anything different. We are repurposing some positions in the civil division, but we should be
And that
adequately staffed. Yep.
self-insurance fund represents all that non-general fund items within the
Right.
budget framework. Councilmember
That's right.
Johnson.
Thank you, Mr. Chair, and thank you, Ms. Siegel, on the presentation, all the great work of the department. I just had a general question on the budget. I noticed what jumped out to me was a 14.1% increase in salaries and wages, even though the FTE count is staying the same, and I was just wondering if there was an explanation for that.
I mean, they're almost all union positions, so it's whatever the contract requires.
Ms. Green?
Councilmember Johnson, the reason why the increase is gone up a little bit higher than the rest of the department is a portion of the $200,000 reduction that took place in 2016 was added back into those line items in 2017.
So
So it was a couple positions. Last year, what the department decided to do was not take that reduction, so that's why you still see the positions, not eliminate the positions. And this year, the mayor has reinstated the reduction that took place in 2016.
Okay, so it was money taken out, but the positions stayed. And
The position count stayed, the dollars were
Position
removed.
count
Yes. No
stayed, so-
dollars were associated with the positions that were, with the positions.
Gotcha. Okay, thank you.
So there was just sort of a placeholder that experienced the budget change in 16, and now it's being reinstated in the 17 budget. Is that correct?
That's an accurate statement.
Okay. And were there any reclassifications because you've repositioned some of the current FTEs?
Yeah, Mr. Chair, we've had some reclassifications, but probably, relatively insignificant in terms of the budget. with that $200,000 reduction, we have used basically our fringe benefit line to subsidize that reduction this year.
Mm.
And so, with the fringe benefit line, that's not the right way to do it. The right way to do it is to have adequate salary in your salary line and not to have excess in your fringe benefit line. And so that's, I don't know if I accurately represented that, Ms. Green, but
And
that's
Bill-
how we managed to make it, how we are managing to make it through this year.
Thank you. And building upon Councilmember Johnson's question a little bit, are there a fixed set of vacant positions right now versus what's in the budget? Are we looking to fill positions that are empty, or you know what I'm trying to understand?
Mhm. The
Staffing
Mis-
levels.
Yeah, Mr. Chair, the criminal division, the general fund, all positions are filled. They're all filled.
Okay.
And then we also, something else that may impact it a bit is we've got this 2-year pilot for this charging team, which is 2 1-year, two one-time. So we have 2 FTEs that are in fact temporary through 2017.
Thank you. Councilmember Johnson?
Thank you, Mr. Chair. Thank you, Ms. Siegel, and thank you, Latonia, for that explanation. I do notice the $200,000 accounts for close to about 5% of that, but that would still have salaries and wages going up roughly around 10%, which seems, which is unusual compared to the other departments. So I'm not saying that's something that I disagree with. I just like more information on. So maybe we could talk offline and just, I understand if there's union contracts were renegotiated, salaries renegotiated, or I guess just better understanding that would be appreciated. And so we can chat offline about that. But I just wanted to ask that we have that follow-up. So thank you.
Mr. Chair and Councilmember Johnson, absolutely, we will do that. But I can assure you, and my staff would certainly be happy to assure you that nobody is getting a 10% increase. I mean, I think they're in our contract, it's like 2.5%, something like that. So I don't want people to think that, the fat cats in the attorney's office. I mean, we hire lateral attorneys who take substantial pay cuts just for the opportunity to work for the city, because we are so good and such a great place to work.
It's a great law firm.
Absolutely. Thank you.
Councilmember Palmisano. That was left over. Thank you very much, Mr. Siegel.
Thank you, Mr. Chair and members of the committee.
Appreciate the attempt to keep on time or catch up at least. Mr. Todd, you're the recipient of people eating up some extra time, so we appreciate your presence here.
Thank you.
Give you any opportunity you need to make those slide transitions. Please don't steal the zip drive from the attorney's office.
She's a tough act to
Yeah.
follow, trust me.
Whenever you're ready, Mr. Todd.
Thank you. Give me just a moment here. Get my notes together. Perfect. I'm ready to go. So, good morning, Mr. Chair, members of the committee, Patrick Todd from the Minneapolis Assessing Department. It's a pleasure to be here to present our 2017 budget proposal. With me today, I'd just like to introduce, we have the director of the department, Rebecca Malmquist. I also have 2 of the residential supervisors, Denise Lingwall and Saray Garnett-Huhuli, as well as we have Matt Sandell, who is our IT and manager of assessment services. He does a lot of the number crunching and the CAMA work within the city of Minneapolis, as well as I have Paige Moody, who was a step-up intern in our office, and she was doing a phenomenal job on some of the projects that we had picked. And so we ended up offering her an internship until the projects that we had identified for her are complete. So with that, I think we can begin. So the very first slide we are presenting here would be the organizational chart. The organizational chart hasn't changed in a number of years. It for sure didn't change between last year and this year, and I'm not sure if there's much need to discuss that. It is done by organizational projects or sections within our department. It's not a pretty typical, it's an atypical actually organizational chart, but if you have any questions, we can discuss that offline. Under the budget summary, the general fund for 2016 was $5,027,275. The recommended budget was $5,266,649. We've asked for an additional FTE in our department. In addition to that, we're asking for additional education and training and licensing dollars. In addition to that, we do have a capital campaign request as well. The core programs within the Minneapolis Assessing Department. The Minneapolis Assessing Department, our purpose is to value and classify all the real estate within the city of Minneapolis each year. We do that by looking at or inspecting each property. We have 130,000 properties within the city of Minneapolis. This year, our residential staff, we're just wrapping up our equalization in the summer. We've door knocked about 19,000 properties so far this summer. We have about 3,000 left to do. It's quite an accomplishment. I'm sure as council members, you do door knock when it comes to election time, and 19,000 is an outstanding number of houses to hit. So, but as part of what we do in the city of Minneapolis, we do property inspections, we do the exemptions, as well as any property tax relief programs, which is blind and disabled, it's homesteads, it's veterans exclusions, it's the exemptions. We have probably the most complete and most accurate data as far as data information and property records in the city of Minneapolis. The CPAD and reg services, police, fire, all rely upon a lot of the information that we store in our property records system. We do property tax or taxpayer notification, taxpayers appeals, tax court, as well as neighborhood and business relations. And we do that all with a smile on our face. So to talk a little bit about the first request, which is a lead appraiser position. This position will handle all the exemptions within the city of Minneapolis. That is 7,300 parcels, around $12 billion in exempted value. This person will be the single point of contact. So when anyone has a question or has any issues with exemptions, they would have one person to call. This individual will handle the customer service of the department. We currently have a front lobby as a front counter where we handle walk-in business. This position, we don't really have somebody managing this position at all. At this point in time, we also have 3 clerical staff or support staff, I should say, that handle the walk-ins, that handle the phone calls, and are doing work with the general public. This person would manage the workload as well as the outcomes of the classification staff. That'd also be the first point of contact for 311. In addition to those 2 items, they would handle all the personal property and railroad accounts within the city of Minneapolis. In addition to that, they do the community engagement and community outreach. This is something that's new. It's something that I think is it's something that we probably need to elevate to a position. And that's where we do quite a bit of a tax exempt and nonprofit work for the city of Minneapolis as far as getting the communication out, but we probably don't do a good job getting that information out to underserved communities or communities of color. I think if we made a special effort to make sure that the information is at least accessible, or if not, being even more proactive and going into the communities and talking about programs that are out there, we might find that there's a number of organizations that are doing good work, but don't realize or don't know how to apply for tax exemption. And this person would be responsible for that. These 4 areas at one point had been handled by various people within the office. Over the years, when we've taken budget cuts, we would basically take those positions and parse them out. Generally, for the most part, the people that have been doing this work has been my leadership team. I've handled all the exemption within the city of Minneapolis. My director, Rebecca, is doing all the customer service for the city of Minneapolis for the lobby and the support that's up front. Matt Sandell in the back is doing the personal property accounts and the railroads. Again, these are positions these were tasks within our office that had been, we had specialists back then. And again, as those positions were lost, we just took them and assigned them to the person that was probably most knowledgeable in the area, not necessarily the best place for a position. But now I think if we can bring them back and put them under one individual, we can really do the city a service, because we can have one point of contact. We can make sure that the information is being handled correctly. It's especially with exemptions. We do a reassessment of exemptions every 3 years and every 6 years. We're finding we're just finishing up that process. There's a number of exemptions that as exempt organizations, as the funding doesn't become available and they have to close their door, they're not generally calling the assessor's office and say, oh, by the way, we're done. We don't have the funding. So some of these buildings can sit empty and still be not on the tax rolls. And we need to do a better job of following up on not only just reading the newspaper and keeping up on media, but being aware of what's going on in the market so that as buildings turn over, we can be there to make sure that that these properties are returned back to the tax rolls as at the most appropriate time. And that also takes into consideration when I was out there taking a look at these properties is that exempt organizations also are oftentimes start because they've got funding and the funding changes or dries up for them. And then they find other funding for other purposes, which might be very worthwhile or worthy. Unfortunately, exemptions are for a very specific purpose. And so when an exempt organization, let's say, is helping a nonprofit and that funding dries up, they find another purpose to help maybe, say, low-income affordable housing. That's a completely different use. They would have to really reapply. They'd have to take a look at the income. We'd have to take a look at who's donating to the organizations, making sure the missions and the vision of the organization are within the parameters of the statute. So long and short, I'll keep this sweet because I know we're running out of time. By funding the lead appraiser position, the city leadership will be providing more opportunity for residents to access property tax programs. The city leadership will be providing more opportunities for engagement and value with the valued charitable and supportive organizations in the community. And finally, the position will also build public trust by delivering services and information to underserved communities and communities of color where none have existed before. Next slide would be the education. We're requesting $100,000 in education. Back in 2013, the legislature changed the minimum requirements, or I should say the qualifications for assessors. All the assessors are now required to have what's called an AMA certification or accreditation. Back when the legislature did that, only about 16% of my staff met those qualifications. Since then, we've put in a plan to get everybody through the appropriate education and training. We've got a model set up for the most part. We've got people dedicated to parse out time within their work schedule to dedicate to the education and training and writing of the appraisals. I'm happy to say so far we've moved from 16 to 30%, which might not sound like a significant movement, but we absolutely think that's a huge success. We are on track to be 100% compliant with the legislature by July of 18, which is about 12 months earlier than we need to be. Some of the challenge we have is that in getting people through this AMA certification, the more experienced people, the people that have come in or have been working in the office have a number of the courses that they've taken or that are required, I should say. So we don't have to pay to have those classes taken. There are people that are coming into the assessor's office that have degrees from St. Cloud University that are real estate degrees. A lot of those classes transfer over, so we don't have to spend a lot of dollars on that. But when we're hiring people that don't have much of a real estate background or are coming from the real estate sales, we have to spend a significant amount of money, up to about $7,500 of training and education to get them to the AMA certification. So let's see.
Mr. Todd?
Yes.
Before you can continue, Councilmember Palmisano.
Thank you, Mr. Chair. Mr. Todd, could you help expand our understanding of what exempt parcels are? I typically think of them as churches, but I don't think there's 7,300 of them in our city.
Sure.
And is it largely based on state law?
I'm sorry, what was that?
And is the exemption largely based on state law?
Yes, absolutely. Through the chair, Councilmember Palmisano. Yeah, exemptions are, there's one class called nonprofit. They have a completely different application. They have a very separate, they have a very unique set of qualifications that they have to meet. Oftentimes they're referred to as the North Star factors. That's, if you're going to be a nonprofit, you need to go through that track. The other ones are, for the most part, I would call they were statutory exemptions. If you're a school, if you're a church, if you're a cemetery, if you're a hospital, if you're a library, if you're, I think there's one more. It is what it is. So if you're a hospital, one, you're for the most part exempt. If you're a school, as long as you're a legitimate school, you're exempt. Whereas nonprofits, you can be a nonprofit, but you might not qualify for property tax exemption. A lot of it is dependent upon how you function, who you're serving, and if you have fundraising or are supported by charity. Those are a lot of the criteria that are used. But so I would say there's two tracks, one that are, I would say, statutorily exempt because it's pretty clear cut. The other one is really dependent on their mission and the funding.
And then also, if I may, a couple of slides back, it also refers to personal property. And I
Personal
don't
property account, sure.
understand, because that to me would be any single-family homeowner or private business owner.
Sure. Through the chair, Councilmember Palmisano. Personal property, and I wish it was a better term, but in our industry, that's what it's called. It's oftentimes referred to as a personal property. Most of the houses and most of the real estate on Nicollet Island are on what's called a personal property account because the park board owns the land. And usually how taxes function, if you don't pay your taxes, the city or the county will take your land. They take the land, and if you have a building on it, they get the building as well, but they take the land. Well, in a case where you have an exempt organization like the park board, you can never take the land because the park board already owns it. It's exempt. So they put it on a personal property account, which is technically a lien against the owner of the improvements. And that's why they call it a personal property account, because it's just handled differently like a personal property. We also handle it, let's say, for park board land or the sea salt. The sea salt, they're on tax exempt land, but it's a for-profit organization. We put them on a personal property account so that every year they get levied a tax if they don't pay it. It's a lien against sea salt. It's not a lien against the property. And again, if when you own the land, it's a lien against the property. In a personal property account, it's a lien against the individual or the company.
I see.
Does that help?
Very much so. Thanks.
Yeah, I've never heard that. Thank you for that question.
Yep.
Very enlightening.
And the Paradise Charter is the other one that we had a difficult time with. I don't know if you know who they are or not, but again, it's the park board. They own a dock. They lease to a charter system for a number of dollars, and we said we have a personal property, and they had a difficult time understanding why it would be called a personal property, but it's just on how you collect the taxes. Let's see. So to get back, so we had the change in the law where we have a plan in place to get people accredited. We have, again, coaching and mentoring. We're doing a pretty good job up to this point in time. I think to support this request of the $100,000, we do have ongoing education. In addition to once they become AMA certified, we have to additionally invest in the employees as an ongoing expense. But just to kind of loop it back, but to a city values, investing in the staff training and development is in alignment with the city values by encouraging staff to be professional, or by encouraging professional development and resulting in knowledgeable, creativity, and innovative staff and employees. Workforce development training programs are a valuable tool in engaging and motivating staff. Real estate and assessing training courses not only bring fresh skills to the department, but also help generate new ideas and innovative solutions to problems while inspiring staff to achieve more. So if we go to the next slide, we'll talk about our performance goals. The city has, or the assessor's office has 5 performance goals. I'm not going to touch on all of them. I think I've covered some of them already. We've talked a little bit about high performing and engaging employees. We've had people going through the designation program. And one thing I didn't really mention is that the education and training and the work they put into it has to be over and above their existing workload. We're not removing the amount of work that they do off their plate so they can do the training and education. They're expected to do the same amount of work in addition to do the education and training. And so oftentimes, we are giving them time away to attend classes, but again, the workload still stays on their desk. For studying, for many of them studying, they're spending time at home and studying and preparing for these tests, writing this appraisal. So it's a real, I'm very proud of my staff, and it's a lot of work, but we're getting there. We also have 75% of the staff. Most of my staff downtown Minneapolis in the Central Business District have an MAI designation. I'm very proud of that. We're one of the few assessing jurisdictions that have an MAI. Again, they've done that. Much of it have been on their own. And why that's important is when we've gone against large organizations in tax court, the appraisers they're putting up in the witness stand is an MAI. And if we're not at least on the same level of education, training, and accreditation, we seem to be starting way back in the pack, with at least with the judge. Right now, when we put up our best up there, their MAIs, they're putting up their best. They are also an MAI. We think it's paying off in tax court as well. Cross-departmental, I'm going to just jump to 4 and 5. Cross-departmental, we're working with communications as well as NCR. We're doing a better job trying to reach out to, we have about 10 to 13,000 properties we think that very well should be getting a homestead, but for whatever reason they don't. So this is one of the projects, the Step Up or Paige, our intern at this point, has been working on with communications, is we're going to be mailing out these postcards to people telling them, hey, did you realize that you could be having a tax reduction or some money back on your taxes if you homestead? So we'll be mailing this out because generally speaking, when people buy a house, it's somewhat incumbent upon them to either have the realtor tell them or the closer, somebody tell them. We really don't have much of an outreach. This will change that significantly. So we're doing it in English and to see what kind of feedback, but we've also, the page has also spent time identifying areas of concentration where we might have a high population of Latinos or Somalis, and we're having these translated and we'll be mailing them out in areas where we think that there could be a payoff, or there could be maybe because of a language barrier, a problem by even, by sending this. It doesn't help if they don't understand it. So we've been working with communications NCR to identify the locations, to translate it and get it out in the mail. So that's a huge success. We've also, within the last, I'd say 30 days, we did 2 programs on La Raza Radio, talking about what the assessor's office does, about the property tax relief programs, and we found that to be awfully fun, as well as we got people to call. Our people were calling into the radio station with questions, and that continued after my appraiser came back. He got many, many, many phone calls from people saying, hey, I heard you on the radio. Can I ask you this question? So that was huge. And then last but not least, we're working on brainstorming so we could get information to the council members so you can get things out into your either blogs or web pages or your electronic notifications to your constituents. Last but not least, I'll talk about CARS. Our CARS request. So we have a request in for $1 million for a new property records and CAMA system. About a year ago, the Permanent Review Committee, the PRC, looked at our contract and said, you installed that system in 2000 and we've never been out for an RFP. We've never looked at the contract since. To be in defense of the company we've been using, we've been very satisfied with the work. They've been very prompt. It's been reasonably affordable. But at this point in time, we're actually required to go out for an RFP. The point where we're at right now, and actually, can we go to the next slide? Because I just think it's a more interesting slide. At this point in time, we're 2 versions behind. Once we were told that we need to go out for our RFP, we've spent time looking at other vendors and the technology they're currently using. Our existing vendor doesn't offer that, and even if we were to spend $250,000 to upgrade to their next .net, it's basically taking what we have today and just putting it on a different platform. It's really not providing us the tools. It's not providing us the GIS integration, the photo integration, the mapping, and all the great technology and the tools that are currently available in other systems are not even available in our current system. And I think when we're talking about the millennial generation and people really wanting to have a front-facing system, that's exactly what we're going to have to take a look at, because the system we have now doesn't even have the capabilities and doesn't, in our mind, in the future, doesn't even have the future capabilities of the system that we think is appropriate for an assessor's office of a city of the first class. So with that, we knew we were going to have to go off for RFP, whether it's funded or not. We have to do this. We have pulled together an IT staff. We have a BA and a project manager. We do have an assessor staff identified for this RFP project. We're looking at system requirements, best practices. And one thing, I've been in this industry long enough, anytime you go through an RFP process and you do take a look at what are your current needs, what do you think your future needs are, you find opportunities for efficiencies. And that's probably one of the biggest benefits of doing an RFP, is that you get to step back, take a look and go, why are we doing this? Why aren't we doing this? And who handles it? And sometimes some of what we're asking in this lead appraiser was coming up because of that. Some things are being done because out of desperation, you just put it in somebody's bucket list and have them do it. Now we're stepping back, we're making sure that we're doing things correctly, because when you're going with a whole new system, you don't want to build in the deficiencies or the obsolescence into the new system. if you don't have to. So lastly, in 2017, we'll have the RFP proposed, put out there. We will evaluate. We'll do demos in 2017, and in 2018, we're budgeting and planning for an implementation of a new CAMA system. And last but not least, this is not a system that just benefits the city of Minneapolis. The data that we store is used by police, fire, reg services, CPAD, 311, 911. So it is a system that would probably touch a lot more departments. Obviously, we would benefit the most, but we are very much the source for real estate data for many of the other departments as well. And I think that the tools that some of these other vendors have out there will probably allow them to have access to more and better information as well. And with that, I'll stand for questions.
Well, you're right. That last slide was very informative, and I appreciate that. I've been watching this for the last couple of years, as you know. In your role as the chair of the statewide association, I imagine this is something that's coming up in other municipalities, whether it's county or cities across the state. Are we looking to build some best of class or some comparative data on how other people are doing this? We've used a 15-year-old system, and it's not going to be supported in the near future, but where are we at with looking at what other cities are doing?
Mr. Chair, they oftentimes refer to the cutting edge as the bleeding edge, and we're fortunate back in 2000 when we rolled out Govern, we were absolutely the cutting edge system. Other people were either didn't have computers or were still doing things on paper or doing things in Excel. We rolled it out and we were one of the best. Today, I can say that Hennepin County's spent almost $12 million to put in a CAMA system and a tax system. Now, we don't have to worry about the tax system component and a record system. But they're rolling it out hopefully in 2017. Scott County is also working on a new system. Dakota County just rolled out their new system and has been up and running with a vendor they're extremely happy with. Anoka County has picked a vendor and are working through the requirements. So I think we're in the best position because we're able to learn from a lot of other cities who have done it and have said this worked and this didn't work, or what they promised us, this is what was delivered, and we would do it a little bit differently. So I would say that we're probably in the best position because currently Hennepin County literally is rolling it out next year, and they've got 6 years into the development. So there might be an opportunity to partner with Hennepin County. We'll absolutely look at that, but we also want to take a look at the other options as well.
Very good. Well, thank you very much. Appreciate your presentation. I don't see any other questions. The professionalism and quality of work that you guys are exhibiting every day is much appreciated, but often overlooked. So
thank you very much. Appreciate it.
Mr. Todd. That concludes our series of budget presentations for this morning. The next time we'll be meeting on this topic will be on October 6th, and that's the morning will be devoted to the Public Works budget, and then the afternoon will be beginning at 1:30. We're beginning the Community Planning and Economic Development Department, as well as Regulatory Services Department budget presentations. So with that, our meeting today is adjourned.